What's that sound? Some people say it works when traditional methods fail. Have you more faith in a spoonful of medicine than in the power that animates the living world? While others say a physician should practice a method of healing founded on scientific bases, and he should not voluntarily associate professionally with anyone who violates this principle. It's the most non-scientific healthcare delivery system in the United States. What is it? How does it work? Is it worth your time and money? Today we're talking about the health practice that has backs cracking across the country. Chiropractic. You're listening to the Mind the Gap podcast, bridging the gap between your minds and everything else. I'm Keegan Gwydolyn.
And I'm Mackie Drew.
And our show today is called Quacropractic, and this is our show about chiropractic. So Mackie, you're going to get us started off with some history, right?
Yeah, okay, so chiropractic, a really interesting topic because it's so prolific, but it carries a lot of controversy with it as well. First off, chiropractic was founded by Daniel David Palmer, or D.D. Palmer as he went by, in Davenport, Iowa. He is from Ontario, though, so that's kind of cool. So he was originally a magnetic healer. So he would use magnets to try to cure illnesses, and he started a magnetic healing facility in Davenport, and he called himself a doctor, but not everyone was so convinced of that.
Big surprise.
A local paper actually wrote about him saying, a crank on magnetism has a crazy notion that he can cure sick and crippled with his magnetic hands. His victims are weak-minded, ignorant, and superstitious, those foolish people who have been sick for years and have become tired of the regular physician, and want health by shortcut method. He has certainly profited by the ignorance of his victims. His increase in business shows what can be done in Davenport, even by a quack. So, quite strong words for D.D. Palmer in his magnetic days.
And I'm kind of surprised that the term quack existed even back then.
Yeah, it's only 100 years ago. I mean, it sounds like a long time ago.
It's like it's a solid 110, 20 years ago.
Well, quack sounds like a 20s word to me, so it's got to be around near there.
I guess
Doesn't it sound like a 20s word to you?
Say it in the American accent.
I don't.
He's a quack.
You mean
see?
There's no, it's a transatlantic accent?
Whatever.
Anyway. So yeah, after that scolding review, Palmer hypothesized that manual manipulation of the spine could cure disease. So that's what you recognize today as chiropractic, a spinal manipulation where they crack it, or they move it in certain ways, and that's supposed to cure illnesses. And he initially kept chiropractic a family secret for 3 years, which sounds a little odd.
Don't share the family secret.
Yeah, like for 3 years. It sounds like something you'd be hiding for hundreds of years, Yeah. This is the family recipe for chili or whatever.
Foreshadowing.
Foreshadowing. But yeah, in 1898, Palmer began teaching to a few students in his Palmer School of Chiropractic, which is still around, by the way. It's
Where is that?
Davenport, Iowa. But yeah, his son Bartlett Joshua Palmer, or B.J. Palmer, as he called himself, became committed to promoting chiropractic, and he took over the school in 1906, and he basically let in a lot of people. 1,000 was at the most, so that was pretty big back then.
Wow.
But yeah, the basis of chiropractors believe was that all disease was caused by interruptions in the flow of innate intelligence, which is basically like like a vital energy of life, like a magical force that flows through either our veins or other extra tubes, depending on who you ask at the time. But yeah, that it represented God's presence in man, and chiropractor leaders often invoked religious imagery and moral traditions. And also, the D.D. Palmer has sort of been accused of stealing from osteopathy, which is a very similar technique, who have since foregone spinal manipulation.
Yeah.
And that was much more popular in chiropractic at the time. So he distilled it down to something else. So both the DD and BJ both seriously considered declaring chiropractic a religion. And that was what their idea there was, to be protected from any legal prosecution for any of the claims they make medically.
Really?
Yeah, so because under the U.S. Constitution, of freedom of religion, and avoid any kind of extra jazz like that, but they went against it because they didn't want to be confused with Christian Science. So so that's their reasoning. But you can see it was very religion like. It had a big aspect of morals, tradition, spirituality, things like that.
Very spiritual.
But yeah, the chiropractic was sort of like not really taught so much as a medicine, but more as a sales pitch. It had a big component of this throughout the entire history of the school. It was done by D.D. Palmer and really amped up by BJ. And here's a quote from B.J. Palmer saying, "We manufacture chiropractors. We teach them the idea and we show them how to sell it."
Wow. Contrast that with, your standard physician, who is more concerned with dealing good health.
Their mantra is more do no harm.
Yeah.
Obviously, a long-standing feud between chiropractors and medical doctors, and it continued for decades. And the AMA, the American Medical Association, labeled chiropractic as an unscientific cult in 1966. And until 1980, it advised its members that it was unethical for medical doctors to associate with unscientific practitioners. But it was sort of in 1961 that chiropractic started to take a turn in the right direction, in that it wanted to do away with a lot of the spiritual components, things that weren't really founded. But in 1961, Samuel Homala wrote extensively on the subject of limiting the use of spinal manipulation, and he proposed that chiropractic should be a medical specialty that would focus on the conservative care of musculoskeletal conditions. So it would be more like physiotherapy. Rather than, again, like the osteopaths ditched the spinal manipulation, so too he suggested that the chiropractors would. And this kind of started a big debate, and they really didn't start doing any good research into whether it was effective or not, any of these chiropractic theories, until the 1970s. And it was all of this research was continually hampered by constant anti-scientific and pseudoscientific ideas that was sustained in the just sort of like the mindset of the profession. It was all about the spirituality and how to correct the magical flow of energy through the body. But after the release of the first journal in the 70s, in the late 70s, for actual research for chiropractic medicine, that it was sort of a turning point in that a lot of people consider that to be actually when chiropractic was invented in 1983. But that brings up a big issue.
Yeah.
What is chiropractic?
Well,
and that's a question I constantly wrestled with while writing this episode.
Yeah, and that's what I found as well, and I think something that's going to be echoed later on in the episode.
Yeah, we're doing an interview with a chiropractor.
Yes.
And
even she doesn't seem to have the same idea of what chiropractic is as other chiropractors we've spoken to, or the ideas that are put out by official regulatory bodies and associations and stuff like that.
Exactly. There's a lot of focus again now on things like the musculoskeletal system. So like physiotherapy essentially. It's just a different name for physiotherapy in some cases, and in some it's complete like absolute like
Drivel.
magic. Yeah, magic. And there's a difference there. It's between a straight chiropractor and a mixed chiropractor. A straight chiropractor being the ones.
I'm gonna get into all.
Oh,
that
you're gonna
stuff
get into
later.
that? Okay. Okay, I just wanted to try to make it clear. What we're talking about here is the spinal manipulation and things like that. Maybe even the use of the term chiropractic. Like some of the modalities used by chiropractors, like physiotherapy, can be effective, but a lot can't, and a lot can go wrong.
Mm-hmm.
And there's a lot of regulatory garbage that goes along with a lot of this chiropractic stuff, and that's what we're dealing with here.
And next up, we've got an interview that we did with my cousin, Andrea Gwidolin, who's a chiropractor who works in Ottawa. She'll introduce herself a little bit, but we hope you enjoy the interview.
So I'm Dr. Andrea Gwidolin, a chiropractor practicing in private practice in Ottawa, Ontario, 3 years into practice, so I still consider that pretty new.
How long did you go to school?
So I started my post-secondary education through the University of Western Ontario, now I guess Western University. I completed an honors degree in kinesiology there. Then I continued my education at the Canadian Memorial Chiropractic College in Toronto, and that was a 4-year doctorate program in chiropractic.
Oh, well, what made you decide to go into chiropractic?
Essentially, it was a really positive experience as a young child and growing athlete. I had the very unfortunate situation of being hit by a car as a young child and required a little bit of manual medicine. So it was something that was always kind of in the back of my mind as an alternative sort of healing approach to the human body. And as I went through my high school years, I kind of was looking into whether it was medicine or physiotherapy, and chiropractic always kind of stood out as the one thing that I found that really helped me when I was a young dancer and a young athlete, that really had a minimally invasive approach to healthcare that really worked well for me. So at that point, that's when I looked into a little bit more of which schools were available to me and what the curriculum was like. And I essentially applied and got in, and that's kind of where my career started then.
I was wondering, since I'm now in medical school at your alma mater, what kind of stuff do you cover in chiropractic college? Like, what's the curriculum like?
So the basic core curriculum, so starting out in first and second year, there's sort of the introductory to basic health sciences that most people would have covered in an undergraduate program, but it's kind of the next level. So different labs, lectures, small student groups that cover the basic sciences. So your anatomy, your physiology, biomechanics, pathology, those sorts of things, which then progress as the years go on through chiropractic college. Always building and looking at the different aspects of the human body and progressing that way. Another area that we really focus on, obviously, is the technique side of things. So learning not only how the body works as a whole and through the biomechanics, but then how our joints move, how they should move in a normal range of motion, the pathologies that affect the joints and the muscles, the effect of the nervous system on the human body and movement function. And so we work through things like that, as well as obviously clinical diagnosis, orthopedic testing, diagnostic imaging such as x-rays and MRIs. So those are kind of the core foundations that we go through throughout the 4 years of practice through school.
Could you explain just briefly how chiropractic works through its mechanisms?
So the essential foundations are the assessment of human movement through the spine, but also the extremity joints. So we're always looking at how the body is moving, how it's not moving. That's where kind of the orthopedic testing side of things comes in. When we are experiencing pain or some sort of joint dysfunction, you want to assess what the problem is. So whether it's coming from the spine or from the hip joint or from the elbow, there's always a mechanism of injury or dysfunction. So that's the core foundation, is finding out where the problem is coming from, whether it's a referred pain or if it's an organ referred pain. Those are things that we really want to look at. In terms of the actual mechanics of the spine, that's basic our foundation. So assessing that. And then
So you'd be manipulating the spine in some way?
that's one of the most common approaches that a chiropractor would use is manual medicine or spinal manipulative therapy. But there's also the other side of how the joint works, the soft tissues, the ligaments, the tendons, the muscles. So it's not just the adjustment or the manipulation of the joint itself, but the correction of a muscle imbalance or myofascial adhesion. So there are different things that work on the joint complex as a whole that we want to make sure we're focusing on. But yes, spinal manipulation, extremity manipulation, joint mobilizations, corrective positioning, rehabilitation, the whole gamut of making sure that that joint is moving properly.
So what conditions would you say would you have that would make you want to go to a chiropractor?
Well, a chiropractor is the doctor of the neuromusculoskeletal system. So our focus is on how the body's moving. Typically, patients present to us with back pain, neck pain, headaches. It's typically pain related. Because, if you're feeling great, you usually aren't worrying too much about yourself. But that's typically what would walk in to see a chiropractor. Depending on the chiropractor themselves, I personally do a lot of extremity manipulation. So I work on the shoulders, the wrists, the feet, different areas that obviously are not related directly to the spine, but influence our movement as a whole. So I see a lot of sports injuries in my practice. I work with a lot of young athletes, the ultramarathon runners, a lot of that kind of active community who experience a lot of repetitive strain injuries, overuse. So those are things that we're always looking at. But those are probably the most common things that would bring someone into a chiropractor, usually pain.
And what would differentiate your practice from the practice of, say, a sports physiotherapist?
They're actually quite similar, to be quite honest. Sports physiotherapists, depending on what their training is, not all of them do manipulation. Some of them do joint mobilization. So as a chiropractor, we obviously do manipulation. That's one of our front line of treatment. But in terms of the actual care itself, it's actually quite closely related. Now, that being said, we do work quite well together and on an interprofessional team. And depending on the patient and what their needs are, I definitely refer to sports physicians more than sports physiotherapists. But we obviously recognize that there's a large scope of care that's available to patients. And so it depends on what the patient needs.
Would you say that it has any risks associated with it?
With any course of treatment, there are risks. And that's one of the things that we obviously go through before we do any treatment, a fully informed and signed consent form with our patients. So when you're looking at the way that the body works, there's a normal range of motion throughout the average joint. It varies from different patient populations, geriatrics versus pediatrics or high performance athletes. But when we look at the range of motion of a joint, we want to make sure that it's moving properly. And so if it's not, then that's when we want to use mobilizations and manipulations. Obviously, bones have a certain amount of flexibility. Depending on, say, a geriatric patient, they might not have the same flexibility of their bones, more osteopenic or osteoporotic. So in that case, there's risks of rib fractures, stress fractures, things like that would happen to the body just the way that the bones are. So those are things that we have to be careful of. And so there are ways that we would change the way we would treat a patient who has osteopenic bones so that we're using a different amount of force in a different way than, for example, someone who has no pathology to their bones whatsoever. Obviously, there have been cases where patients have presented to a chiropractor for something such as neck pain or headaches. The reason we do a thorough examination is to find out if that headache is being caused by something related to their vasculature, such as a stroke, because neck pain and headaches, dizziness, they can all be early signs of a stroke. So those are things that we have to assess for. And unfortunately, there have been a few rare cases, and I do highlight that it is very rare, where patients have been experiencing a stroke and have had a regular treatment without any maybe additional testing that day of the visit, and they have gone on to have a stroke. That's not to say that spinal manipulation causes a stroke, and there is actually quite great literature to show that we don't cause strokes or we don't cause any vascular issues. But there are issues related to the body that we have to fully assess for. So those are just kind of a few of the general risks that people tend to worry about when they hear about chiropractic. Cracking the bones is not what we're doing. We're adjusting the joints and there's a gas release. But some people do think, oh, they're going to crack my bones, they're going to break me, that sort of.
All right. Now, I came across some fairly radical claims as well about ideas of it treating infections and cancer. I'm sure, that you've heard those as well. Would you consider that in any way effective against those kinds of things?
When we're looking at the human body, there are different interactions that can happen. So we do know that by being pain-free, low stress, our body is able to heal itself pretty well. So I think when you're looking at the whole body, I mean, delivering a spinal adjustment, to me, I know that I'm not curing cancer and I know that I'm not curing a bacterial infection. However, there are quite a few patients with comorbidities that do experience a higher level of relief when their body is feeling well. So our clinic actually has quite a good partnership with a cancer survivorship center in Ottawa called the MapleSoft Survivorship Center. So we do see a lot of cancer patients. Our aim is to improve their quality of life while they're undergoing different treatments or different sessions to help their body heal. So we're aiding in that healing simply by making sure that their body is moving and feeling well, not that we're replacing chemotherapy and radiation with our chiropractic treatment. So there is a different distinction.
You feel that it should have an additive role and not replace conventional?
Absolutely. Our whole idea, or at least speaking on my own experiences, is that we work very well in a multidisciplinary setting. We're a very specialized and important role in the healthcare system and the healing of the human body, but we work well with others, and that's when referrals and communication come in so importantly to make sure that our patients are getting well, not that they are trying to cure certain illnesses with the wrong treatment.
A little bit more on the role of chiropractic in a person's life. Do you think that there should be any kind of age restriction on chiropractic care? Too old or too young, perhaps?
Absolutely not. A spine is developing throughout our entire lives, from a young child to an aging older person. There doesn't need to be a limitation in that as a chiropractor, we're trained to treat different populations with different approaches. So obviously when I'm assessing a young child and treating them, it's very different from how I'm treating a middle-aged person or an older person because of the nature of our anatomy and our bones as we're developing. But we all have spines, we all have muscles, we all have a nervous system that's firing and helping us develop and grow. So there really doesn't need to be an age limitation as long as it's benefiting the patient's health.
You know, chiropractic is sometimes a little controversial. And how would you deal with a person who denies the efficacy of chiropractic?
Again, through education and directing them to a very growing body of evidence that chiropractic care is cost-effective and very efficient. We have excellent patient health profiles and safety profiles. So just sharing that information with them. We've got a wonderful body of evidence that's growing, and one area in particular they can look into is the Index to Chiropractic Literature, which has a large body of evidence that is available for people to see. We also have the Canadian Chiropractic Research Foundation, which is working to get the research and the evidence out so that people have that information. I think it's just a lack of that information right now that can lead to some of that controversy, but there is a growing body of evidence available to them.
I was wondering if you could just take us through sort of a day in the life. So what's a typical day as a chiropractor?
A typical day for a chiropractor. So I work in private practice in a multidisciplinary clinic. I typically see patients throughout the day. Going into the office, booked patients in. Typically there are a couple of new patient assessments each day. So that would require a history taking, a physical examination, the possibility of referral for diagnostic imaging. And so that's kind of that new patient assessment. An average patient visit, depending on the patient, would be maybe some rehabilitative care, some spinal adjusting, working my way through helping patients throughout the day. There's quite a bit of paperwork, as with any profession, so that takes a little bit of time as well. But it is quite rewarding being able to help so many different people achieve a healthy lifestyle. So that's one of the things that at the end of the day, despite all the hard work, it's really quite rewarding. A little bit different in my practice from maybe other chiropractors is that I do some insurance assessments as well. So that involves me working with a physiatrist and assessing motor vehicle accidents and WSIB cases to determine what their further needs are from an insurance company. So that's something that I also do as well. But yeah, that's kind of my average day, is just basically focusing on my patients and assessing and treating them as I can.
Great. Thank you very much, Andrea.
I'll briefly describe now what chiropractors claim to do, at least officially. The Ontario Chiropractic Association describes the practice of chiropractic as a manual approach which provides diagnosis, treatment, and preventative care for disorders related to the spine, pelvis, nervous system, and joints. And they list several reasons that you would seek chiropractic care. Among them, we have back or neck pain, headache, whiplash, strains and sprains, repetitive strain injury, work and sports injuries, arthritis, limited range of motion in the back, shoulder, neck, and limbs, and general health and well-being. So this is a very broad reasons to see a chiropractor, and I know for sure that at least one of them is actually contraindicated by medical doctors. Medical doctors say that you should not be seeing a chiropractor if you have arthritis, because arthritis destabilizes your joints, and you can cause some serious damage if you're, manipulating them like that.
Yeah, I know the British Chiropractic Association doesn't specifically says on their website that you should never claim to treat whiplash with chiropractor or chiropractic care.
Yeah, whiplash is very, very serious as well.
They got some serious trouble a few years ago on that. So yeah, just interesting on that note. So yeah.
We kind of talked about the history, but chiropractic on a philosophical basis is based on a number of pseudoscientific notions, including, as Mackie, you said, subluxation and innate intelligence, which aren't supported by evidence. Innate intelligence is the idea that life contains a force called innate intelligence, which is responsible for the organization, maintenance, and healing of the body. Chiropractors believe that they remove interference between the nervous system and other areas so that innate intelligence can act via the nervous system to heal disease. Some chiropractors have interpreted this principle more recently in a more scientific light, as homeostasis. So they say that innate intelligence is actually your body's own homeostatic mechanisms, that is, the body's ability to maintain its internal norms.
Yeah, so it's got the same pH, it's got the same amount of water, changing temperature, yeah, things like that, pressure.
Yeah. The other interpretation of innate intelligence is that of scientific ignorance. So they say that the innate intelligence that's acting is the stuff that we don't know what it is yet.
Yeah, so the innate intelligence being something that heals the body on its own, and if you interrupt it, it's messed up, right? You don't get healed on its own anymore.
Exactly.
And they're saying that science doesn't understand it, but they know.
Yeah. And an example of something that would block the flow of this innate intelligence is something that you see very often in chiropractic, called a vertebral subluxation. Now, subluxation is an actual medical term, but there's a very distinct difference that the World Health Organization and most medical associations make a distinction between chiropractic and medical subluxation. So chiropractic subluxation is defined as a dysfunctional biomechanical spinal segment which alters neurological function, which blocks innate intelligence and prevents natural healing. Now, some interesting things here. The founder, Palmer, D.D. Palmer,
emphatically stated that a subluxation was not the same thing or even similar to a pinched nerve.
So, so the point being here that sometimes people say, oh, a subluxation is a pinched nerve.
Exactly. People
Okay.
say, oh, it's a subluxation, it's a pinched nerve, and that's altering neurological function, right? But no, that's not what we're talking about here. What Palmer was talking about when he invented the term subluxation was what he called a blockage that interfered with the vibration of the nerves.
Oh, man.
Yeah.
This is a whole nother level.
Now, I'm only a lowly medical student, but I'm fairly certain that nerves do not vibrate.
Well, I mean, they vibrate like everything vibrates.
Yeah, nothing particular to nerves.
No special, it's not like a vocal cord or a string instrument. Or
Exactly. Now, a subluxation on top of that cannot necessarily be seen on an X-ray. You'd think that, it's, your spinal cord is misaligned. You will be able to take an X-ray and you'll see that it's misaligned and you'll be like, oh yeah, look, there it is. There's the subluxation. But no, you cannot necessarily see it on an X-ray.
Not that stops chiropractors from having them in the office, though.
Exactly.
Yeah, that's a big ethical point I've seen brought up, that you expose people to unnecessary X-rays when it's not been demonstrated that anything can be gathered from those X-rays.
Yeah, and just, again, I know a little bit about medicine because I'm in medical school, and these are people who are trained usually for 4 years, and they are given an X-ray, and apparently the skills to interpret X-rays. Well, in fact, if you want to do that in actual medicine, conventional medicine, you have to do medical school, and then you have to do a further residency, which is another 4 or 5 years, in radiology, where you study the interpretation of medical imaging like X-rays.
Yeah, it's no joke. They've got huge amounts of resources and schooling that goes into using X-ray machines. It's not a simple task. It's not something you can pick up on a weekend.
And it's not very easy to interpret an X-ray correctly.
Mm-hmm.
So, all in all, there's not much proof that subluxations actually exist. And a 2008 book called Trick or Treatment, which was co-written by Simon Singh, who is a physicist, and Edzard Ernst, a professor of complementary medicine, this book said, quote, X-rays can reveal neither the subluxations nor the innate intelligence associated with chiropractic philosophy, because they do not exist, end quote. The next thing I want to talk about is the breakdown of chiropractors, and we sort of alluded to this earlier. They can be broken down into the thoughts of straights versus those of mixers. So straights are concerned with the detection and correction of vertebral subluxation, that misalignment of the spinal vertebra that we talked about earlier. They correct this via adjustment with the belief that any other patient complaints are caused by the subluxation. So if I go into a chiropractor's office and I say that my leg hurts and I've got a lump on my arm, the chiropractor is going to ignore those things and he's going to x-ray my spine and look for a subluxation. And when he doesn't find it, he's going to start cracking my back. When Mackie goes in to the chiropractor, the very same chiropractor, and says he's got a headache and he's got blood in his urine, the chiropractor is going to ignore both of those things, x-ray his back, and when he doesn't find anything, crack his back.
So these are the straight chiropractors.
These are the straights, and they are staunch adherents to D.D. Palmer. Mixers, on the other hand, mix diagnostic and treatment approaches from osteopathic, medical, and chiropractic views. So we kind of talked about this earlier. And they believe that subluxation is one of many causes of disease. So unlike the straights, the mixers are not going against the germ theory of disease. They employ conventional techniques of physical therapy, like exercise, massage, ice packs, moist heat, nutritional supplements, that sort of thing. And they still believe, however, as moderate and rational as the mixers seem in comparison to the straights, they still believe that 62% on average of disorders of internal organs are caused by vertebral subluxation.
Well, maybe not all do, but
They got a whole bunch of chiropractors to say what percent they thought
Oh,
were caused
okay.
by
So
subluxation, and the average between all of them was 62. Just some general facts. The incident rate for fraud is 9 times higher in chiropractors than in MDs.
wow.
So chiropractors generally do worse on every metric, pretty much. They were rated lower than MDs and, in fact, all other medical professions, health professions, I should say, by U.S. adults when rated on the question, rate the honesty and ethical standards of people in these different fields. It was rated dead last.
Huh, I'm surprised with that. Like, a lot of people don't like dentists. I thought they might just be spiteful.
Dentists did well. Nurses
Oh.
did the highest. And
See, I love
then
dentists.
I think it goes nurses, doctors, dentists, psychiatrists were like 2% above chiros.
You know, some of my best friends know dentists. All right.
So guess where the highest use of chiropractic in the world is?
I'm going to say Ontario, Canada.
It is not Ontario, Canada. It is Alberta, Canada.
Oh.
20% of the population uses chiropractic.
20%?
Yeah.
Isn't that like way above the 9% of the US? Isn't the US 9?
U.S. is around 9. It fluctuates between 6 and 12 in Canada and the U.S. overall.
Okay. Fair enough.
Yeah. A bit on the evidence side.
Yes, this is the meat of the matter. Everybody
Yes.
pay attention.
So the way we look at this is you can't ever look at a single article, a single study, right? When you're evaluating something so broad as chiropractic medicine, you
have to look at several things. First off, what I like to do is I look into a mechanism, and then if I can't find a valid mechanism, look into the epidemiological data. So you find out whether or not it works. So you poll 1,000 people and you see how well does it work versus just not doing anything or giving a similar placebo effect. And if you can find something there and you make one good study, then that's still not enough to decide what's going on. You need to find 10, 20, as many studies as you can and look at all the data and come to the best conclusion you can based on that.
Right. And when we look at the collective results of many, many studies, we are doing a systematic review. So there have been a couple of these done over the years. In 2010, a systematic review in the International Journal of Clinical Practice stated that there is no good evidence to assume that neck manipulation is an effective treatment for any medical condition, and it suggested that although casualties are rare, it should be avoided as a precaution. It also states that the risks of chiropractic outweigh the benefits, and this is kind of what this is kind of what we are going on. This is the pattern that we see. 2009 review in preventative medicine. Remember, the Ontario Chiropractic Association said that having a preventative visit to the chiropractor is good practice, right? They want you to go there just to help sustain your health. So a review in preventative medicine stated that spinal manipulation is routinely associated with considerable harm, and no compelling evidence exists to indicate that it prevents symptoms or diseases.
Ooh, I hadn't heard of this one. That's
Yes.
good. That's a good one. Preventative medicine. I need to read that journal. That sounds like a blast.
Yeah.
All right.
Most reviews indicate that the risk is low, so we're not necessarily saying that chiropractic is dangerous per se. So the risk is generally low, although accidents do happen and people do die and are horribly injured by chiropractors.
Paralyzation.
Yeah, stroke, stuff like that. So other reviews indicate that while the risk is low, the benefit is essentially non-existent, particularly with respect to spinal manipulation. And that, the other joint manipulation and sort of muscular manipulation that you do doesn't have any benefits over physical therapy.
Yeah, which is what was kind of our point, right?
Exactly. Ultimately, chiropractic has been shown at best to be as effective as other forms of manual therapy like massage for treating back pain, neck pain, and sometimes headache. The main opposition, however, despite the fact that it can kill people, despite the fact that it has no evidence for it, the main opposition should be that it's rooted in the fact that it undermines the scientific enterprise, and it takes advantage of its own low standards of evidence and puts people's lives at risk. And when you think about someone who goes to a chiropractor, this is someone who usually it means conventional medicine has not worked for them, which is usually because they have a chronic or debilitating disease that we just don't know how to cure properly. That means that this is a very, very vulnerable person, and it means that a chiropractor is someone who's taking advantage of that individual and their desperation and ignorance.
Yeah, that's really where you find a lot of this alternative care, where in the edges where science quite hasn't gotten yet. You see a lot of claims about cancer and MS and things we haven't yet cured being able to be cured by these alternative medicines, and it's kind of really unfair because you're getting only the most desperate people.
I have a small group session that I do in medical school, and the doctor who runs it, on the first day, he discussed CAM. And he said that patients like complementary and alternative medicine for 3 reasons, especially in Ontario. Number 1, they pay for it. So psychologically, they want it to work.
There's been a demonstrable effect that the more you pay for care, the bigger the placebo effect is.
Exactly. Number 2 is they give you time. They give you a lot more time than a traditional doctor generally would, which is unfortunate. It's just a side effect of the demand on the healthcare system.
Studies have also shown that the most effective placebo effect, versus taking a pill versus taking a fake vaccine, the most effective is a very attentive and non-rushing doctor. So,
And the third point is that patients, as I said, are usually desperate at this point, and they're looking for hope to contrast with the sort of harsh dose of reality that a physician would be ethically obliged to give them. And those are the things that I think drive CAM and chiropractic, is that, they're going to see people who are going to tell them what they want to hear. Yeah.
I mean, and at the point, if they are completely untreated, the risk to themselves personally is not high, because they'll die soon anyway,
or they'll
regardless
continue
of the care.
To be in a lot of pain, whatever the case may be.
Exactly. But the big risk is those who could get treatment but don't.
Yeah. Now, although I mentioned, for the most part, chiropractic is not dangerous, I don't think it's fair to say. However, it's worth noting that there are some serious possibilities for serious injuries. For example, recently, an Australian baby was diagnosed with torticollis, which is a condition in which a muscle contracts involuntarily. And this particular baby had a neck torticollis. And the condition itself is usually benign. 97% of cases resolve with stretching, and the other 3% have, an underlying anatomical cause. However, this baby was taken to a chiropractor, and the chiropractor was doing a manipulation and fractured the baby's vertebrae.
Yeah, that was a case I looked into. They brought the chiropractor into the hospital without getting any permission for that.
That's right. And the pediatrician who ended up treating the baby afterwards said, quote, "Another few millimeters and there would have been devastating spinal cord injury, and the baby would have either died or had severe neurological impairment with quadriplegia," end quote. And that is just to emphasize how far chiropractors are going with unverified treatments that have no evidence for them, and they're putting lives at risk of babies.
Yeah, I think there should at least be an age restriction. No one under 18.
Well, the thing is, if a medical doctor were to go off and try some unproven treatment, they would have their license revoked immediately and probably brought up on assault charges.
right, welcome to the game section. So, Keegan, you were challenged last week to the 5-minute challenge about Chile, the food, not the country.
Right.
What did you learn about that in your 5 minutes?
Do you want to go over the rules of the 5-minute challenge?
Oh, yeah. Okay, so basic situation with the 5-minute challenge is you get 5 minutes to research as much about the topic the person last week challenged you to. So you'll be, you get 5 minutes of research and you bring all the facts you can to the show, and then the person who challenged you will either correct you on anything you might have gotten wrong or add to things that you forgot or didn't have time for. All right, so you want to go?
Yes. So, as you said, my 5-minute challenge was on chili, the food. So, the full name is chili con carne, which is chili with meat. And it's a stew that contains chili peppers, meat, which is usually beef, tomatoes, and can contain garlic, beans, onions, and cumin. It originated in Texas, U.S., and originally consisted of dried beef, fat, peppers, and salt, which were pounded into bricks and then dried, and so that you could, take a big stack of bricks, take them on the trail and boil it down in pots. So
yeah, almost a tin can.
Yeah, so it's frontier food, basically. There is some debate over what ingredients go into what. So Texas style, some people say it contains beans and stuff. Some people say it contains no vegetables except for chili peppers.
Yeah, no tomatoes. That's a big thing. I didn't realize during this research that there's actually a group of people who don't want tomato in their chili. And I actually made chili last night without tomatoes.
And how was it?
It was a million times better.
Really?
Oh my god, I don't even know what to do. It's what didn't taste like my normal chili, but I loved it. It was so much better.
There's also another variation of chili called white chili, which can be made with white beans and either turkey or chicken.
I agree with everything you said. I just wanted to add a couple things that I had in my research. Jesse James, the outlaw bank robber, whatnot.
Of course.
He actually wouldn't ever rob a bank in McKinney, Texas, because that's where his favorite chili parlor was. But also Lyndon B. Johnson, the 36th president of the United States, has this to say about chili. Chili concocted outside of Texas is usually a weak, apologetic imitation of the real thing. One of the first things I do when I get home to Texas is have a bowl of red. There is simply nothing better. So there we go.
Nice.
Really good appreciation for the red, the bowl of red. All right, so yes, you're challenging me this week to what?
I challenge you to learn as much as you can in 5 minutes about bagpipes.
Oh, good. I'm glad. I've never learned enough about bagpipes. This will give me a good excuse.
I always wanted to play bagpipes as a kid.
Oh, really?
Really?
Why's that?
I don't know.
Is it because of your Scottish heritage?
Of which there is none? Yes.
Ah, yes. Fair. All right. So, yeah, you've got a quiz for me then.
I do. And this quiz is kind of related to chiropractors because chiropractors generally work on your back. So this is a quiz all about the back of things and backs and the word back.
Oh, that's cool. All right.
All right, so I'll just jump in. Teachers say that they have eyes here.
The back of their head.
The back of their head, that's correct.
Awesome. All right. One for one.
The music accompanying a singer when recording vocals is called?
Like the backup? Is that it?
Kinda.
Yeah, the backup singer?
Nope.
What is that?
It's not the singer. It's the music accompanying the singer.
Oh. Sorry, I was thinking about something. The back... I don't know. Tell me.
The backing track.
Okay, I would have gotten that. I don't know a thing about music.
Yeah. All right. Something that is far away from you is in...
The background.
A smaller street away from the main road.
Back road?
Or back street. I'll accept
back street? Okay.
The movie that screwed up the pronunciation of the word gigawatt. Gigawatt.
They called it gigawatt?
They called it gigawatt.
Oh, I know of a show that did that. Superhuman Samurai Cyber Squad?
Nope.
Okay. What is it?
Back to the Future.
Oh, you know what? That's the first thing that popped in my head, too. I should never censor myself.
1.21 gigawatts.
Ah, yeah. Okay, that was before giga was a thing.
Yes, exactly.
All right.
The condition of being out of active development or consideration.
Oh, put to the back. They all. Does it have the word back in it? Do these
Yes,
all have?
They all have
okay.
the word back in it.
Okay. Then why did I guess Superhuman Samurai Sack Squad?
I don't know.
All right. Back seat?
Nope.
Like put to the back seat?
Nope.
What is it?
Put on the back burner.
Oh, I knew that. All right. What is it? Is that all?
2 more.
Okay, cool.
An indirect or insincere comment is...
Backhanded.
Good. A goal that bounces off and in for a point is...
A goal?
Yes. In a sport that I cannot name because it'll give it away. A goal that bounces off and in for a point is...
Why do you gotta pick my 2 categories of no knowledge, sports and music? I don't know. I'm gonna say a back point.
Nope. It's off the backboard in basketball.
Oh, backboard. Okay, I knew there was I was thinking basketball.
Yeah.
I had that going for me.
Bounces off the backboard and goes into
Man, I did
point.
relatively poorly considering I assume that must be an easy quiz to some.
Well, let's see. You got back of the head, you got background, you got back street, and backhanded. So you got 50%.
Oh, I'll pass.
Barely.
Ah.
Not a med school pass.
It's a med school perfect.
Med school, you need 65 to pass.
Oh, I didn't know that. Okay. Well, all right. Then,
you also need 65 to get perfect.
Yes, exactly. So I guess that's the show. Email comments, questions, refutations to anything you've heard here today to mindthegaphosts@gmail.com. Our next show will be called All the Colors of the Grainbow. Subscribe to us on YouTube, iTunes, or the podcast feed of your choice, and be sure to like or rate us depending on our platform. Thanks for listening.
Have you more faith in a bottle of pills than in the power of the universe? Chiropractic is the sensible choice. Soon they will turn to first.